and Vidya works with a lot of pediatric population with autism, sensory processing disorders, learning disability, etc. So I'll let Vidya take over. So yeah, Vidya, you can go ahead.
Hi, everybody. Good evening. And I'm really happy to be a part of this webinar, actually. And good to see you all. I I see that a lot of our parents have been able to come, and we'll have few more joining us in, I believe. Okay, so I would like to actually tell you guys that it would be fine if you can add in any questions in the chat while the webinar is going on, and we can answer it towards the end, or if it's like really relevant to what we're talking about, we can answer it along with the questions, along with the presentation. Okay. All right, so shall we start? Okay, so yeah. So I'll just give a brief on what is OT in general. So many people have a misconception, or some people really don't know what occupational therapy is about. So we are actually a profession that deals with people from right from their birth all the way up till their death. That's how I would like to say it. Because any stage in life you might encounter a problem with, there might be a chance you'll have a difficulty with any one area of your life. It can be because of a disability. It can be because of a traumatic injury. It can be because of some developmental delay, or it can be some other psychological factors that is hindering you from doing it. So we help you with all these areas. So no matter what issue you're facing, if it's hindering you from functioning well in your daily life, we are here to help you with that. Okay, so what we do is we assess the situation. I'll give you an example. For example, if it's a child having autism, okay, same. So when a child having autism comes to us, he or she will have, a lot of parents have come to me with the major concern that their child is not looking at them in the eye. He's not responding to when he's called by his name. So what we do is we find out why he's not looking at you in the eye, and we give therapy, we give activities that will help him build up that confidence. It might be because of his confidence, it might be because he finds it too he is too anxious to look at you in the eye, or it can be because of some sensory underlying problem. So we find out what the issue is, and we give you activities related to that, and that in turn will help the child to build up that ability. Okay, so we use mostly functional activities as opposed to many other professions, like say physiotherapy, or other professions. They use a lot more of physically or trained set of principles and things, but we use regular daily activities to help them build up their skills. Okay, so this is in general a brief about OT. So from now on, I'll be referring to occupational therapy as OT. So I'm just telling that so that you guys don't get confused. Okay. So our basic goal is to help people maintain and regain independence, or gain independence when it comes to kids. Okay. All right. So yeah, with OT, kids can develop different kind of areas. So we deal with all these different areas. So we'll start with gross and fine motor skills or motor coordination. So that actually talks about the ability to do things in a coordinated manner. For example, there's a water bottle with me. Okay, me being able to reach out to the bottle and hold it and grasp it correctly, and being able to open the cap and drink water from it requires a lot of coordination. Okay, so some kids may not be able to do that. So in that case, we help them build up that skill. Okay, it can be gross motor coordination that is gross when it comes to larger joints. When larger joints are involved, it is called gross motor coordination. And when smaller joints or more minute, precise movements are required, that is called fine motor movements. So we help in all these. And also in general motor coordination, which helps in skills like balancing themselves, being protective when they fall, things like that. Okay, so it will be like more of a protective responses, preventing themselves from danger, having a danger sense. All this comes under gross motor, fine motor skills, motor coordination, balance, all that. Okay, And the next thing that we help with is basic life skills. So life skills include anything and everything that we do in our life right from when we wake up. For example, we wake up, we wash our face. So washing our face comes under grooming. We brush our teeth. That also comes under grooming. We bath. We take bath. We go use the washroom. We eat breakfast. We drink water. So all these skills are our basic life skills. It can be dressing, eating, bathing, and toileting, grooming, all this comes under basic life skills. Okay, so some kids will have difficulties in planning the sequence of how things are to be done. Some kids may have a difficulty in seeing which is the right side of the shirt. Maybe they'll wear it outside first or inside out. Or some kids have a difficulty in understanding which is the front and back. All these issues, we help them deal with that. Okay. And when it comes to brushing or eating food, it might be some sensory problem that they're dealing with. They might not like the sensation of the brush touching their teeth, or they might not like the sensation of the gooey oats that we're eating. It can be something like that. So all these help, we deal with all these. We help kids to understand what is happening to them, and also we'll teach them skills. We'll teach them coping skills, coping mechanisms to deal with whatever is happening in their body. Okay. And then the next thing that we deal with is positive social interactions. So social behavior, it includes everything starting from a social smile. You see a person, you greet them with a smile. Or you see a person, when you go back, when you leave the person and you go back, you say bye-bye. You smile at them, or say, have a nice day, nice meeting you, or something like that. Also, when you hurt someone, you go say sorry. When somebody gives you a gift, you say thank you. So kids sometimes lack this behavior. They're not, especially with COVID and all this happening here in our present, life right now. Kids are, not very exposed to things that are happening around us. Social interaction has come down to very badly. And that has affected a lot many kids in our, our area or our environment, like all around us. Yeah. So we help in building up these skills. We provide group sessions. We provide interactive sessions in which it'll help build up that behavior. That social behavior is always promoted. Yeah. So we work with that also. And also there are other areas we work with. We can also help kids with, chronic disabilities. We can provide them with services where we can suggest them adaptive devices or modified environments where that will help them function better. For example, I can talk about, say, a child who had a spinal injury. Okay, say a traumatic spinal injury. And that child can benefit from OT. You might ask how. So what we do is we'll assess the child's environment. We'll assess his activities on a daily basis. And what we do is we provide him activities or modifications that can be done in his environment that will help his functioning much better. For example, he might not be able to get up from the bed and go to the toilet by himself. So we can provide him a wheelchair that will be perfect for him. We can advise him to get the perfect wheelchair. We can give him measurements. We can give him ideas that will help him from tipping over from the wheelchair. Things like that, transferring from the bed to the wheelchair, all that. Okay. So these are some of the areas that we work with kids in specific. Okay. So other age groups, we'll deal with all the other areas, but I'm talking about kids here. Okay. And yeah, talking about the common common diagnosis that we deal with. So we do help with kids with autism, and autism, sensory processing disorders, and ADHD all come under, majority of kids having these diagnoses show a lot of similar, problems, concerns given by parents about kids having these diagnosed with these issues come under a lot of similar areas. So I'll give a brief in general about these areas. So mostly kids with autism, ADHD, and sensory processing disorders have difficulty sitting still in a place. They find it really difficult to sit in a place and do an activity, or they will have a difficulty in completing an activity at a stretch. They will not be able to, say, sit still for 5 minutes and complete an activity that I'm doing. They might want to shift from one activity to the other. They'll be playing with the blocks 1 minute, the next minute they'll want something else. They go with the cars, they'll come back and they'll want to play with something else, say dominoes or Legos or something one after the other. So we will help them sustain their attention. We will find out the reason why they're not able to. So with ADHD kids, mostly it's not about a sensory problem. It's because they're not able to sit still in a place and attend to a task. It might be overwhelming to attend to a task at a stretch. So we'll give them activities based on attention. When it comes to sensory processing disorders, it can be because they're not able to process all the sensations that's coming in. But for a normal individual or typical individual, neurotypical individual like me, I'll be able to process all the information that's coming into my brain and I'll be able to filter it out. For example, my fan is running currently. My fan sound is not disturbing me from talking to you all. But when I'm a neurodiverse individual, like an autistic person, I will not be able to block out the noise of the fan. So that will hinder me from talking to you all. So that, what we work with is like, we'll help the kids to focus on one thing, on mindfulness, and help them with coping mechanisms that will help them block out these extra things that are coming into their brain. And if in case they feel overwhelmed, we give them techniques that will help them be more regulated. Self-regulation is one other thing that we help them with. Okay. And autistic kids have both sensory processing disorders and other things also. So it is a spectrum. Autism spectrum disorder is what we've come to call it now. So it has many things that come under autism. So mostly autistic kids have certain, mostly we say it's stimming. So some kids keep playing, tapping with their finger. Otherwise they'll, keep doing this movement on their hand and they'll keep looking at it. Or they'll have something in their hand to keep fidgeting with it. Or they'll keep moving their legs. Or they'll keep, rocking themselves. It's all their ways of regulating themselves and keeping themselves calm. So what we do is we give them other, coping mechanisms that will not be so overtly, evident that I'm having a problem, I'm not able to handle myself, but we'll give them other things that will help them cope with it and also be in a, inclusive setting with the neurotypical kids. So we'll be able to get the children school ready for, getting integrated into the normal society, to living with the normal, the typical normally developing people. Yes, I do say, while I'm also advocating for the kids with autism and sensory processing disorders and ADHD, all these special kids are special. They require to be, all these disorders should require to be normalized, and people should not be looking at them in a, weird way. But there is always this pressure to function in a typical way and to get integrated into the typical system. So even if they are different, it will, we are helping them to live with the neurodiverse people. Sometimes for I'm sorry, I meant to live with the neurotypical people. So sometimes for neurodiverse individuals, it's really hard to keep up with us. We are too annoying to them. We are too irritating to them. So we give them coping mechanisms to handle us. That's how I would like to say it. Yeah. And the next thing that I want to say is about developmental delays. Developmental delays mostly happen when kids have a slow development. Like, it might be because of a damage that happened at birth. It might be because something that happened before birth. It can be a number of reasons. So basically, developmental delay is when a kid is showing a year, 2 years or more of delay in their development. So it can be milestones starting from, say, rolling over, crawling on all fours, excuse me. Yeah. So it can be crawling on all fours, or, walking, speaking, everything comes under this. So any delay in their developmental milestones comes under developmental delays. So we help them develop in the norm, like at the right time. Or if there's a delay, we help them come up to their age appropriate development. Okay. So we give them therapies, we'll give them activities that will help them build up to that. Yeah. And then behavioral problems, mental health issues. Mostly it comes hand in hand, both one after the other. Sometimes it comes different. Yeah. So behavioral problems, mostly the children show tantrums, adamancy, wanting, if they want a thing. Excuse me, can you turn off your audio? Yeah, thank you. Yes. So when it's behavioral problems, kids show a lot of adamancy issues. They will have difficulty in, at times when kids are not able to communicate to us properly, they will have difficulty controlling their anger. They will be frustrated with themselves that they're not able to communicate with us. So we give them anger management techniques. Okay. And when it's with adamancy, or children being to showing doing temper tantrums, like rolling on the floor and crying when they don't get something that they want. So things like that, we give the parents tips on how to handle situations like that, and also we help the children to regulate their emotions. So if they should understand a situation and be able to understand that, okay, I'm not getting this at this point. Okay, I need to calm myself down. And maybe at some point later, my parents might give it to me. I have to wait until then. Okay, some kids have a difficulty waiting for their turn. So when you're playing a game, they might jump in between, and they'll want to do something. They'll want to say something. They might be tired of sitting silent for a long time. That will want them to jump up and speak up or scream or run, something like that. So all these come under behavioral problems, especially when they go into a school. When they go into a school setting, into a typical school setting, they will have difficulties in sitting still in the class and keeping quiet, because teachers will say pin drop silence, and everybody has to say stay pin drop silence. So some kids will have difficulty understanding that. Sometimes kids think that I am sitting silent, but they might not be silent, they might be humming. It's because they, in their mind, they need that amount of humming to feel that, okay, I'm calm, everything's silent around me. But for others around them, it might not be silent. So things like that, we need to teach them, we need to make them understand. So we help with all that. Okay. And then the next thing that we deal with, one of the many things that we deal with, it's cerebral palsy. Cerebral palsy is one neuro disease, not a disease, I would say, sorry. It's a neurodevelopmental issue that happens when a child has a brain injury before the age of 5. Okay, so what happens is, like, if any area of the brain can get affected, and that might lead to the child having muscular problems. Their body might be stiff, their body might be too loose, they'll not be able to do movements, they might be, they'll not be able to develop, properly at the, age appropriate development might not be there, and other related things. And also, but most cases, in majority of the cases, children with cerebral palsy are intellectually perfect, but they might have physical issues. So for that, we give them neurodevelopmental therapy, and that again, we'll be able to advocate to the parents, and the parents can do it. Okay, we'll give them techniques and activities that they can do. Yes. And so we'll move on to the next. Yes. And so, yeah. So as we all know now, since COVID started, online, everything has become online, starting from school, doctor's appointments, your work, everything has become online. And although online OT was there long ago, it wasn't so common. It really came into, a common platform when, not just OT, any other medical field. It came up now when COVID happened. So that was, I think, a big plus for a lot of people. And because of that, we've been able to, explore an area that was not really in public, out in the public before. Yeah. So what we do when in online OT sessions is that we assess a person at first. Okay. So we do individualized assessments based on whatever issues they have. And we assess the person's functioning, what do they want to work on. Okay. And we give a client-centered approach. That's how I would like to say it. I mean, it's not just what I would like to say, it's how it is. Yeah. So we give a client-centered approach. And what we do is we ask the person what is important to them. Okay. So if it's the child, we ask the parent what is important to them. And we prioritize our plan of action based on each client. So it's a patient-centered, each individually tailored approach. Okay. So we plan an action, we plan a set of therapy for each child based on their problem. Because again, each person might have say 10 kids have the same diagnosis, but each child is different. No one child is same as the other. Everybody has a different problem, and everybody's source of the problem might be different. You cannot say that my child has autism and their child with autism is doing something way better than mine. Mine should be doing that way. No, you cannot say that. Your child might be dealing with something else. It might be something else that you need. So you cannot say that, okay, they did this and it worked for them, so I'll do that for my child also. It might work for my child. No, it's the same way as we say when you take medicines, when you go to a doctor, they prescribe medicines for you. So it's not like it worked for one person, I'm going to take the same medicine, it'll harm your health. So that's what I'm trying to say is, if you use the same techniques that was used for some other kid without consulting an expert, it will harm your child instead of helping them. So always, go to an expert, get their advice, and make sure you're not indirectly harming your child, unknowingly harming your child. Yeah. So what after personalizing the plan of action, like prioritizing and planning according to the person's interests, we give them functional activities as intervention. So it might sound like, okay, what is this person doing? Okay, my child is having a difficulty in brushing and she's asking me to do brushing with him. No. What we are trying to do is we'll split up the activity into different parts. And we'll ask you to work with one part. Maybe I'll ask you to, go and ask him to, bite on a biscuit, or maybe introduce some fruit, some vegetable to his diet. So that will help him overcome a sensory deficit or a sensory issue that he's dealing with. And that will in turn help him in his brushing. So you might not at first understand why we're trying to say this. Okay. So that is another benefit of the teletherapy platform, what I would say, because at the same time, while we're telling you what we want you to do, you can always ask us questions. You can always, get back to us and ask us, why are you trying to make me do this? Why is my child needing this? I'll have enough time to explain things to you. Okay. And on a teletherapy platform, sessions happen on any online meeting platform, say Zoom or Google Meet or Teams, Microsoft, or something like that. Or some people even have their own teletherapy platforms. So however it works for each therapist and each patient, it happens that way. And always with online OT sessions, we have supplementary home programs. So we'll always be giving you homework, which you have to do at home. And I would like to stress on this point more than anything, that without a home program, without the proper continuing this thing at home, nothing's gonna work. Having your child sit in front of a screen, listen to us for a 40-minute session or a 45-minute session a day, or say once or twice a week, is not gonna help the child. You will have to follow through no matter what. So home programs is the most important part of any OT session, be it offline or online. Okay. So yeah, I'll move on to the pros and cons of OT. Online OT. Yeah. So because I just mentioned earlier that we'll have more time to explain things to you. One of the major reasons of having more time to explain is because I'll have less, traveling. I'll be able to sit in my own personal space, and I will be able to, cater my services to you. You will be able to sit in your own personal space and listen to me. So that traveling thing is a big plus. We'll not have to do the traveling. And no matter what happens, say distance, it's time zones, or, sometimes it's rainy and you cannot go to your center. All this doesn't affect our sessions. So that. And also the child will be more comfortable when he's at home in his own, personal space, all this. And the next thing, the parents are an active part. So we'll be just a guide, and you will be the ones who are doing sessions for the child. And always when the parent is an active participant, they will know the reason behind why the therapist is asking me to do something. They'll have a clear idea of what reasoning is happening in the therapist's mind and why she's asking me to do this, all that. Okay, and also no matter what time zone, we'll be able to handle all of it. Like even if because of this online thing that came up, we are able to cater our services to people in areas that are not reachable, otherwise. People might be in area time zones that are too far away, that are not reachable via, say, it's in a remote place. Even in that case also, we'll be able to cater to them. Okay, and sometimes obviously there are cons to everything. So as as everything comes in, online OT also has its cons, and one of the major things happens is stability of network. Sometimes unstable network hinders us from communicating well. Sometimes there'll be lag. Sometimes we'll not be able to communicate properly. Yeah, so that is there. And in some cases, we always, some cases, rarely, we feel that the physical presence of a therapist might be needed. And in those cases, we'll always let you know that it will be better if a physical therapist takes it up. Physical therapist, and I mean not a physiotherapist. I mean the physical presence of an an occupational therapist. I'm really sorry. Yeah. So that is few of the cons. All right. And I will give you a brief on two of our cases, two of the children who have come with me. So one was a 3.5-year-old child with autistic features. She had poor eye contact. She wasn't responding when her mom called her by her name. She was constantly humming, singing, or tapping. And she used to cry herself out whenever she was called to brush her teeth or cut her nails. And she couldn't sit still. She always wanted to jump around, but she was really happy. Was really adamant. She threw tantrums no matter what. And she really wanted to make things happen. Yeah. And also she had frequent toilet accidents also. So with her, what we did was we did sensory integration therapy. We did toilet training with her, and also we gave her activities tailored for her for eye contact, sitting tolerance, and responding for name call, and also behavior modification for the temper tantrums and adamancy. With regular practice at home and consistent sessions, thrice a week was what she did. We could see a noticeable change in 2 months. And actually, the child was discharged recently after 6 months of therapy. She is now attending school in KG1. Yes, she has some issues occasionally. Yes, she does have, but she is able to go hand in hand with the children in her class with, no. And one thing again, when parents are doing online therapy, they are able to, carry on the therapy even if they stop therapy sessions with us, because they are already trained. We're giving them lifelong training. That's what I would like to say. Yeah. So the next child is a 7-year-old male child. I mentioned the initials of the children for privacy concerns, so please excuse me for that. Yeah, and he had attention issues. He had difficulty sustaining attention. He couldn't he was always distracting his fellow students. So he was climbing up windowsills and he was jumping down without the concept of danger. And he had a lot of interest in tumble play, like rolling on the ground, falling over things and playing like that. And he had difficulty in dressing himself, like wearing shoes and socks, putting up the buttons for his shirt, all that. And he was a messy eater. He wasn't bothered if food came all over his face, or even if his hands were messy. He was fine with that. He wasn't bothered. He would walk around with a messy face and a messy hand. He was fine with that. And also he had an untidy handwriting, because he couldn't sit still for completing the handwriting and completing the thing in proper manner. He used to just rush through all the activities. So for him, we gave him again sensory integration therapy. You might wonder why, because understanding from all these issues that he had, we really understood that he had some really bad sensory issues. I would say starting from being a messy eater, that shows tactile sensory issues. Not being able to see, not being able to understand what's happening around his mouth, not being able to understand that his hands are messy. That shows an inability to understand the tactile sensation that's happening here. So for that, we gave him sensory integration therapy. We gave him training for his difficulty in dressing, that is ADL. And we also gave him attention activities and sitting tolerance activities. And we gave him behavior modification for self-regulation, because he was distracting his fellow students at school. He had to regulate himself when he felt the need of, extra input of sensations. So that's what we did. Again, the parent was really consistent in coming for sessions, and they practiced at home, which gave wonderful results. We actually could see changes in him after 3 months. Yes, 2 months, 3 months is a long time, because when you take medicines, you get the result in, say, a day or two. But with sessions and therapy, it takes time, because we're not giving medicines, we're working on the child's behavior, and it's going to give a long-term impact. It's not just short-term. You take a dolo, the effect stays for 6 hours, not more than that. So that is one thing. Okay, and now the child is attending regular school. He has a supporting staff for a short while. After that, he'll be weaned of that also. Yes, so we have time for your questions now.
If any parent has a question, they can unmute themselves and ask, or also please feel free to type in the chat. We actually only have 4 minutes, so we can take 1 or 2 questions if you have.
I see a question by Ms. Renu. Is there a difference between sensory integration therapy and occupational therapy? Sensory integration therapy is one specialization that we work with. It's a specialty. It comes under occupational therapy. Okay. Yeah, I don't see any more questions. You can ask any questions if you want.
Vidya, till then, if you want to say 2 things that the parent should remember, when they are taking OT, what would be 2 tips that you would like to give them?
Okay, when they're taking OT, one thing I've always noticed parents say is that we don't see improvements fast. So, always wait at least 2 months before you jump into a conclusion that your child is not showing any change. And even after 2 to 3 months, if you don't see any change, move to another solution that you want. Yes, that's exactly what I was talking about. We got a question, how long does OT take to work with? So is it lifelong if a child has few sensory issues like feet up and tics? Yes. So if it's a mild thing, we can work with it and the child might get over it as the therapy moves further. But in severe cases, yes, the child might need sensory inputs throughout his lifetime. But again, we'll give them a sensory diet which they can follow, and they'll be trained to do that throughout their life. So that's how things are. And the next thing that we would like to say, during assessments, please make sure that you're being 100% truthful to the therapist so that they'll be able to understand what we're trying to say, what you're trying to say, and what we'll be able to analyze your issue only if you're 100% truthful. So don't hide your child's issues from when you come to talk to us.
Yeah, but I think we can move ahead.
Okay, so I will just give you a brief on how we do things at Sounderic. Okay, so yeah, and how we do is we have a free 15-minute consultation, which can be booked on our website. I have given the website here. So during the 15-minute consultation, we'll be analyzing your issues. We'll be understanding what all issues you have, and we'll give a idea on how things will be and how many sessions we can take with you. And each session will be 40-minute sessions, and it will be conducted on Zoom. You'll be given the link via our clinic's WhatsApp. And here's the here's the contact details on how you can reach us. So you have our mail ID, phone number, and also our website. We have a free screener also, which you can fill up before your consultations. So it's all available on our website. So do check that out. Yeah. Sami, do you have anything to add on? That's
okay, perfect. Thank you so much, Vidya, and thank you everyone for joining. We are going to keep doing these webinars, and please send in any suggestions or feedback that you have, and we will try to incorporate it in the next one. Thank you, Vidya, again. Thanks a lot. Have a great day ahead, everyone.